Hello all. In this video, we are going to discuss about indicators in demography and maternal health care. First, we look at pure demography indicators. We start with the crude birth that is given by the formula, the number of live births during the year. Since it is a rate, it should be in a specified population and during a particular period also. So it is the number of live births divided by total population. The multiplication factor is 1000. Same way, crude death rate is, instead of live births, we have to substitute the death during the year among the population, particular population, with the multiplication factor of 1000. Then the next important demography indicator is the annual growth rate, which is the difference between the crude birth rate and the death rate, but expressed in percentage. Usually, we calculate the crude death rate per thousand, but for annual growth rate, it will be converted into percentages. Crude birth rate minus crude death rate expressed in percentage. Then the next important demography indicator is the sex ratio. It is the number of females divided by number of males expressed in thousand. This is nothing but the number of females per thousand males, and it is expressed in per thousand males. So this is the sex ratio, which is an important indicator in demography. We have sex ratio at birth. Again, this is also very important and sensitive indicator when compared to the sex ratio, because as age increases, the mortality rates of male and female differs. But at birth is an indicator which is a sensitive indicator for the community, whether it is preferring female or male child. So at birth means it is number of female children per thousand male children. The next important indicator is the total dependency ratio that is given by the formula. Here it is a ratio. So the dependent population will be the numerator, children 0 to 14 years, and population above 65 years of age will be dependent on others. So that will be in the numerator. And the denominator is population between 15 to 64 years. That is the population who take care of the dependent population. The denominator will be the population who take care of the dependent population, and it is expressed in percentage. Dependency ratio is expressed in percentage. It is the dependent population divided by the population who are taking care of them, expressed in percentage. Then we have literacy rate, that is number of literate persons divided by total population in a given year, expressed in percentage. Here the important thing is the numerator is literate person, out of the total population is literacy rate. But we should know what is the definition of a literate person. A literate person is a person who can read and write in any language with proper understanding. We should not skip any of this word. That is a person who can read and write in any language with proper understanding. Then he will be considered as a literate person. So this is the crude literacy rate. Population will be in the denominator, but there is a refined indicator out of this literacy, that is effective literacy rate, where instead of total population, they will leave out the population less than 7 years of age. That is, they will leave out less than 7 years, and they consider in the denominator only population greater than 7 years of age. So greater than 7 years of age will be considered as a denominator. Out of them, how many are literate will be considered as effective literacy. So that is a better indicator, because here we include the children who cannot be eligible for this calculation. So greater than 7 years will be considered as effective literacy rate. If we include greater than 7 years in the denominator and numerator, then that is called as effective literacy rate. Next, in demography indicators, we are going to look at the fertility related indicators. The first important fertility related indicator is again crude birth rate, that is number of live births divided by total population into 1000 will yield your crude birth rate, which is the first and foremost fertility related indicator. Next is the general fertility rate, which is given by the formula, the number of live births among the median female population of the reproductive age group, that is 15 to 44 years of age, expressed in per thousand mid-year female reproductive population. So it is the number of live births given by 1000 mid-year female reproductive population. And we have one more indicator called as general marital fertility indicator, which is the same as general fertility rate, except for the fact that here it is mid-year female population. So instead of that, we get mid-year female married male reproductive population. Then we have age-specific fertility rate, that is the number of live births in a particular age group divided by mid-year female population of the same age expressed per 1000. So that is among certain age group of the females, of the 1000, how many live births are in a particular age group will be considered as age-specific fertility rate. Again, we have age-specific marital fertility rate and one more indicator where the number of live births in a particular age group divided by mid-year female married population of the same age expressed in 1000 mid-year female population of the same age. Then we have total fertility rate, that is after calculating all the age specific fertility rate, that is starting from 15 to 49, for every 5 years we need to calculate the age specific fertility rate and we need to multiply it with 5 and then we need to divide it by 1000. That will yield total fertility rate, that is the completed family size. Next we move on to the gross reproduction rate, that is GRR, which is calculated by again the summation of age specific fertility rate multiplied by 5 for female live births alone divided by 1000. So that will yield the gross reproductive rate, that is calculated by this formula. But what it means is, considering the current fertility and reproductive pattern existing in the country, how many female children the current reproductive female population produce will be this gross reproductive rate. There is a modification of this formula that will be there with the current females. We calculate the number of expected females. But in NRR, that is net reproductive rate, with the current fertility and reproductive pattern, if a female baby is born now, how much female babies that female baby will produce is called as net reproductive rate. So that is also a modification of this gross reproductive rate. Most of the family planning program uses this net reproductive rate. Then we have abortion rate and abortion ratio. There is marriage rate is also there. There is pregnancy rate is also there. And this abortion rate is also there. Abortion ratio is also there. Abortion ratio is the number of live births divided the number of abortions divided by live births expressed in 1000 live births is called as abortion ratio. Whereas abortion rate is total number of abortion divided by the mid-year female population of reproductive age group, that is 15 to 45, 44-year-old female expressed in 1000 will be considered as abortion. That is nothing but the general fertility rate. We have to replace total number of live births with abortion. You get the abortion rate. Abortion ratio is total number of abortions divided by total number of live births into 1000. That is abortion rate and ratio. Then we have couple protection rate. That is again one of the most important indicator in family planning programs. That is the number of eligible couple who are effectively protected against the childbirth with any one or more of the recommended family planning methods by the Government of India. So they will be considered as the numerator, that is eligible couples who are effectively protected will be the numerator and the total number of eligible couples will be the denominator and it is expressed in percentage. Multiplication factor will be 100 here. That is couple protection rate. So out of the eligible couples, how many couples are effectively protected is called as couple protection rate. Then we have Pearl's index, which is an indicator of the effective contraception. So it is otherwise called as failure rate per 100 woman years of exposure. So it is calculated with the numerator total accidental pregnancies divided by total months of exposure into 1200, because we need to calculate it for 100 woman years. So we have this multiplication factor of 100 woman years. So 100 years means 1200 will be the multiplication factor. And for each pregnancy and abortion, we need to reduce certain months in the months of exposure. And after doing that, we calculate the total accidental pregnancy. And this Pearl's index is a index of effectiveness of contraception. So that is calculated by this formula. Then the last indicator under fertility related indicator is the marriage rate. We have two indicator, that is crude and general marriage rate. Crude means total number of marriage by total population. That will give the crude marriage. General marriage rate means out of the population who are unmarried and eligible for marriage will be considered as denominator. And out of them, how many are married every year will be considered as general marriage rate. These marriage rates are not directly used in medicine, but they are used in some social studies. Lastly, we look at the MCH indicators, that is maternal and healthcare indicators. To understand this indicator, we need to understand this timeline correctly. That is, if this is the point of birth of a expected fetus, this is called as natal point. We have to call it as natal point because the terms we use is depending on this natal term of natality. First, we need to understand when a fetus completes 28 weeks of gestation, it reaches viability. And this 28 weeks of gestation age cannot be easily assessed. So for that, we use the 1000 grams cutoff of the fetus. If suppose a fetus weighs more than 1000 grams, then we need to consider it as the fetus has completed 28 weeks. So any fetus with 1000 grams, that will be equivalent to 28 weeks of gestation, will be considered as stillbirth if it does not show any signs of life in the environment. That is called as stillbirth. And if it is still term, it will be called as live birth. And any death which is around this natal period will be considered as perinatal death. That is, peri means around. So it is birth that will be considered as perinatal death. So any perinatal death is death after the completion of 28 weeks and before the 7 days of the neonatal period. We call this first 28 days as neonatal period. Neo means new. It is a new natal period. So that is 28 days or 4 weeks. Or sometimes people use 1 month. So out of which 1 week is called as early neonatal period. And the second week to fourth week will be called as late neonatal period. And any deaths during this period will be considered as early neonatal death and late neonatal death. And whole, it will be considered as neonatal deaths. And any death after this 28 weeks till 1 year of age will be considered as post-neonatal death. And remember, and you should not confuse between post-neonatal death and late neonatal death. Late means during the neonatal period, but it is in the later part, and early, it is divided into early and late part. But post-neonatal means it is after the neonatal period, that is the post-neonatal. Then again we have 1 to 5 year of age, then 5 year of age also people consider. Why we have this timeline is very important is, out of all under 5 death which happens in children, 80% of the death occurs within 1 year of age. And out of this 1 year of age, that is infant mortality, comprises 80% of under 5 mortality. And out of this one year mortality, nearly 75% occurs within 1 month, that is in the neonatal period alone. And out of the total neonatal deaths, nearly 75% occurs within this early neonatal period. So, most important period that we should be careful is this early neonatal period. And why this perinatal mortality is important is, this is one indicator which indicates the quality of both obstetric and the pediatric care. So perinatal mortality and perinatal mortality rates are very important to assess both the obstetric and the pediatric care. So first we move on to the indicator maternal mortality ratio. So it is given by the number of maternal deaths simply. It is the female dying due to the complications of pregnancy, childbirth, or within 42 days of delivery during the period in an area during the given year will be considered as maternal deaths divided by total live birth in the same area and in the same year. It is called as ratio because it is maternal death to the live births and it is expressed in 1 lakh population. Out of 1 lakh population only, it is expressed. That is maternal mortality ratio. The total number of maternal deaths divided by total number of live births into 1 lakh live births. We have other indicator called as maternal mortality rate, where the denominator is not this live birth, but it will be 1 lakh women of reproductive age group will be replacing the live birth in the place of the denominator. So that will be the maternal mortality rate. Two important indicators related to maternal death or the maternal mortality. Then we have stillbirth rate. As I told here, the numerator will be the total number of fetus which is not showing life, which weighs more than 1000 grams weight will be considered as the numerator, or completing 28 weeks will be considered as the numerator. Then the denominator will be the total number of live births plus the stillbirths into 1000. So the number of stillbirths per 1000 live births, we need to include this stillbirths also here. When it comes to perinatal mortality, we need to add the early neonatal deaths into this. Then we will get to the perinatal mortality rate. The only difference is we add this early neonatal mortality to this formula to get the perinatal mortality rate. And as I told, it is an indicator of obstetric and pediatric quality of healthcare. But the denominator have this total live births and stillbirths. This is given in Park textbook and it is used by WHO. So you can stick on to this denominator, that is total live births plus stillbirths. Then the next important indicator is neonatal mortality rate. So here after any indicator, you are going to multiply with 1000 only and the denominator is going to be total live births only. It is same. And then as the name indicates, if you identify the time period through this name, then you can easily identify the time period. That is number of deaths of. So here it is neonatal mortality rate. That means number of death of children under 28 days of age divided by total live births into 1000 will be the neonatal mortality rate. Same way, early neonatal mortality rate is similar to this formula. You get live birth in the denominator, multiplication factor will be 1000. Here the age will be less than 7 days. Here it will be live birth. It will be 7 to 28 days late neonatal death. For post neonatal death, it will be 1 month to 12 months divided by total live births into 1000. That is the deaths in that period will be considered as post neonatal mortality rate. Then we have the infant mortality rate as the most important indicator for the quality of life. So that is the number of deaths of the children less than 1 year of age in a given year divided by live births in the same year multiplied by 1000. Same way under 5 mortality, we have number of deaths of the children less than 5 years of age in a given year divided by number of live births in the same year multiplied by 1000 will give you the under 5 mortality. We have other survival rate, 1 to 4 year mortality and all. That and all is not so important, but we need to understand these rates and how to calculate it and what is the importance of this. As I told, nearly 80% of under 5 deaths happen within 1 year, and nearly 75% of infant deaths occur within 1 month of age, and 75% of neonatal death occurs within 1 week. That is early neonatal period only. So that is very important when it comes to the maternal and child healthcare indicators. Now we will end this session with working out one problem. In the PHC population of 32,000 in Tamil Nadu, the following vital events were recorded in 2009. Number of births is given here. Number of deaths in the first 4 weeks, that is neonatal period, is given here. After 4 weeks, post-neonatal period is given here. Number of maternal deaths are also given here. They have asked for birth rate, neonatal post neonatal mortality rate, infant mortality rate, and maternal mortality rate. So we will try to answer this. That is, crude birth rate is given by the total live birth, that should be 480 divided by the total population, that is 32,000. Crude birth rate, the multiplication factor is 1000. So when we divide this, we get 15 live births per 1000 population in the year 2019 we have to write. So this is the crude birth rate. If we check this, the answer is correct. Next in the question is neonatal mortality rate. So for that, the number of death within first 4 weeks, that is 28 days. So 4 divided by total live births will be 480 multiplied by 1000, which will yield about 8.3 neonatal deaths per 1000 live births. So we need to write like this. Then we have post neonatal mortality rate. Here it is written after 4 weeks. Sometimes they will ask for early and late also. You need to subtract from the given data and you need to get the data. Here the question is direct. So you have to substitute the direct numbers like this. So 480 into 1000, which will yield 10.41 post neonatal deaths per 1000 live births. So answer is here. Then the IMR, that is infant mortality rate. So total infants you need to add up. So that is first 4 is 4, then is 5. So you need to add and provide 9 divided by 480 into 1000. So which will yield 18.75 infant deaths per 1000 live births. So you write like this, it is given here. Then the last is maternal mortality ratio. That is the total number of female maternal deaths. That is 1 divided by live births. That is 480 into 1000, which will yield about 2 deaths, approximately about 2 deaths, 2 maternal deaths per 1000 live births. So you need to write like this. So that is maternal mortality ratio. So in this presentation, we have seen about demographic indicators, fertility related indicators, and maternal and child care indicators. And we have worked out the maternal and child care indicators. Similarly, the questions will be framed for demography and fertility related indicators also, which are going to be straightforward in your exams. And if you understand these formulas, the numerators, the usefulness, you can easily work out the problems and also you can interpret the results correctly. If you like this video, please click on the like button and share it to your friends. If you haven't subscribed to the channel, please subscribe. Thanks for watching.